I have been having knee problems for years, and I was not going to succumb to arthritis because I have too many things to do. You know, I didn't want to give up any of it. I was in physical therapy. Then they started giving me the gel. So I got back to my usual running and my walking, hiking, whatever. In this 1st of December, I got my a gel injection in my left knee. So I took off and I did a 3.5 mile run. 3 days later, I couldn't even move my leg. It hurt so bad. So I went to the ER and they said I had a torn meniscus and a torn ACL.
This patient in particular, Mrs. Nursey, she was very active, enjoys hiking and skiing, but unfortunately while she loves being active, she had very severe arthritis, bone on bone, and felt that she had exhausted all of her conservative treatment options.
But he said, "You're gonna be just fine. Everything will be just fine, I promise you. They've come with new things now and people heal better."
It's a big surgery, but the nice thing is once we exhaust all those other options, patients generally do very well.
I don't know what I was waiting for. My legs never felt better. When I went there, I mean, they treated me like a queen. I mean, they were so sweet at the hospital.
I certainly appreciate her putting her trust in me and giving me the ability to keep her active and get her back to where she wanted to be.